know, when I first started practicing law, and the majority of the clients that I dealt with had their asbestos exposure through heavy industrial exposure or military service and all. And that's where we found a lot of the asbestos exposure, and we still find clients that have asbestos-related disease from those sources. But it seems that when you talk to people today that are victims of mesothelioma, the exposures come from a lot of different types of work areas, school exposures, family exposures. What's been your experience with that as it relates to the disease and the progress that you can make in treating the disease?
We would see probably 80 to 90% of our patients in the late 80s knew where they were exposed to asbestos. Because on every patient who comes through, we take a little questionnaire to figure out where they think they might have been exposed and what their occupation was. Now, only about 60% know where they got it, which means 40% of patients are getting their exposures more likely, more briefly, but nevertheless as effective in causing mesothelioma as some of the ones that you mentioned, refrigeration and so forth. We're seeing a large number of individuals who have either dealt with breaks, we've seen people from schools, and just a variety of different work areas that really need to be looked after. I mean, the composite wall industry, a lot of individuals from that and others that we never saw